Hi, welcome to MedTwins. In today's episode, we will discuss about high blood pressure. Our body consists of a pump and pipe system, which circulates blood through our body. High blood pressure is increased blood pressure within the arteries of the circulatory system. So, how do we measure this pressure? In your doctor's office, the pressure is measured using a blood pressure cuff, which will be put around your arm. You can also buy one of these machines and use it at home to measure your daily blood pressure. The pressure machine will give your blood pressure in two values. One is called systolic, which is on top, and the other is called diastolic, which is on the bottom. So what is systolic blood pressure? Systolic blood pressure measures the pressure in your largest pipe called aorta at the time your heart squeezes and pumps blood into it. Logically, the pressure is higher during this period. Diastolic blood pressure measures the pressure caused by blood in your aorta when the heart is relaxed. Logically, the pressure is lower during this period. Therefore, usually the systolic blood pressure is higher than the diastolic blood pressure. The average blood pressure should be 120 systolic and 80 diastolic. What numbers should we be aware of when reading the blood pressure values? Normal blood pressure is when the top number is 119 or below and the bottom number is 79 or below. Your blood pressure is elevated when the top number is between 120 and 129 and the bottom number is 79 or below. What you really call hypertension, aka high blood pressure, is when the top number is 130 or above and or the bottom number is 80 or above. The third value that is normally shown on a blood pressure machine is your heart rate. How many lub-dubs do you hear per minute? Or how many times does your heart pump during a minute? Normally, this should range between 60 beats per minute and 100 beats per minute. Okay, so now let's take a look at the risk factors for high blood pressure. Your age is an important risk factor. Your blood pressure increases with advancing age. Obesity, having a family history of hypertension, eating a lot of salty food, drinking a lot of alcohol, and not getting a lot of physical activity are also risk factors for high blood pressure. So, why is high blood pressure so bad? If you don't treat high blood pressure, it can increase the work the heart has to do, and this can lead to heart attacks, kidney damage, and strokes. Okay, so how do you recognize if you have high blood pressure? This is tricky. High blood pressure usually doesn't show any symptoms. Therefore, there's a false misconception among patients that if you don't have any symptoms, you don't need treatment. That is wrong, and also it's very dangerous. Because if you don't treat high blood pressure, it can cause serious damage to your body and your quality of life. If it becomes extraordinarily high, then you will even have to get admitted to the hospital for emergency treatment to prevent irreversible damage to your organs. How do you diagnose high blood pressure? Well, routine screening is recommended. If you are 40 years or older, and you have no history of hypertension, then you should do it annually. But if you are obese or if you have a family history of hypertension, then you need to screen for hypertension earlier and more frequently. If your doctor says that your blood pressure is high, usually you are asked to confirm the high blood pressure reading at home, because sometimes a visit to the doctor itself can increase your blood pressure, which is termed white coat hypertension. If your at-home blood pressure readings are also elevated, Then you have high blood pressure. Next important topic is, how do you treat high blood pressure? Lifestyle changes are the initial treatment to decrease blood pressure. Your doctor will advise you to reduce the amount of salt in your diet, lose weight if you're overweight or are obese, avoid drinking too much alcohol, stop smoking, exercise at least 30 minutes per day most days of the week. When these interventions fail, the doctor may start prescribing medications to keep your blood pressure within range. Hope you enjoyed our video. If you have any topics you would like us to cover, please comment below. Don't forget to subscribe and follow us on Instagram. See you next time with another episode of MedTwins.